we can even predict. Because in that organization, it improves productivity, it minimizes absenteeism, and of course, as much as possible, every organization wants profitability. It boosts profitability in that organization. Because even the World Health Organization is now preaching that for every $1 you spend on your staff, you get $4 back. So if you want to translate it into Naira, for every 306 Naira you spend on your staff, you are going to get ×4 of that. Why? Because you are not only taking other things in place. You are not only saying, look, you need 1 month leave. You are not only saying you need so service, house allowance, transport allowance, but you are also telling the person, if for any reason you have challenges with your sleep, if for any reason you are grieving and you need time out, if for any reason your wife is not feeling too well, if for any reason you are depressed and you want to talk, we are here to help. We're in a society where mental health challenges are anywhere because of the single fact that stigma is highly attached to people living with mental illnesses. For that single reason or singular reason, people do not talk about their mental health. People do not express themselves the way they should be talked about. And of course, the social media is definitely not helping in this regard, because for every little thing that happens in anywhere now, on the streets, in our homes, in the offices, somebody is bound to put it up to the world. It has its good part, but oftentimes there are a lot of bad things that come from the social media publication, because that person will keep having trust issues. Who is in that workplace that I can actually express myself to, and that there's no problem with it? For those of us that are Lagosians, one very common thing that cuts across all of us is sleep deprivation. A lot of us don't sleep well. Either you are in denial or you face the reality that we need more sleep, but we are not getting it. Traffic is there, other issues are there that will make you not to sleep well. Of course, we cannot talk about the economic recession that is there, but the truth is that we must be able to understand that if you are not sleeping well, you can't be productive. So in rounding up my discussion, I want us to go with these 3 things. If somebody has a fracture or somebody is very ill, and is taken to the hospital, and the person's illness deteriorates so much, where do you take the person to most times? The ICU, which is the intensive care unit. In mental health, we also have what we call the ICU. ICU, meaning I identify with the stressors that this person is facing. Whether in the workplace, even if it is at home, you cannot take this individual from home, distinguish it from home from the house. Whatever the person is dealing with, at domestic violence, bullying, dealing with a child with special needs, dealing with elderly people, he or she most times transfer it to the house, to the workplace. So identify with the stressors that this person is dealing with. The C, connect with this individual. Connect with this individual. Don't be judgmental. Don't criticize this individual. As much as possible, please don't be apostolic. Even if you don't have anything to tell this individual, not when it is necessary, give the person reassurance, and let us learn the culture of compassion. We need to be able to show empathy, that I don't have the solution, but I am going to help you. So identify with the stressors, connect with the person, and the you, dear, you should be able to find way forward for this person. Unite with the person to find way forward. So I cannot help you because I'm not a counselor, I'm not a psychologist, neither am I a psychiatrist, but I can help you go online to find one. I can help you book an appointment and escort you and go to see a particular person. So please go on with these 3 words, I, see, you, for us to be able to invest in a mentally healthy workforce. Thank you very much.
Distinguished guests, ladies and gentlemen, Dr. Memuna Kadiri. A round of applause for her. I see you. Those are the key words. Next, okay, let me also recognize the director of the Vehicle Inspection Service in Lagos State. He's one of the facilitators, Engineer Toriola. A round of applause for him. Next, I will invite the General Manager of the Lagos State Emergency Management Agency, Mr. Adeshina Tiamiu. He's been ably represented here today by the Head of Operations and Femi Giwa. A round of applause for him. He's going to speak on emergency response in Lagos, the journey so far.
Good morning, distinguished ladies and gentlemen, the DG and my very able directors and very senior colleagues here. I say a very good morning to everybody. I want to extend the greetings and the highest assurances of the General Manager Lasema, who is unavoidably absent. Is actually somewhere doing the business of emergency management, and he of course sends his greeting and regard. And he of course hope that at the end of the day we are going to have a very fruitful program. Today I am standing in the gap for the General Manager Lasema, and whatever you hear today, just take it as though it is the General Manager himself that is speaking in absentia. We will be delivering a paper titled Emergency Response in Lagos State, the journey so far. And of course, it is in consonant with the Vision Zero conference that we're having today. Emergency, emergency, emergency. We all talk about emergency. Perhaps we want to look at what is the interface or what is the link between emergency, disaster management, and safety. Today, all over, we talk about Vision Zero. And Vision Zero, of course, if we go down the memory lane, Vision Zero itself emanated in that should be 79 from Sweden, 1997 in Sweden, where perhaps they were talking about risk reduction. It's a strategy for disaster prevention that actually focuses on reducing the number of injuries and death, and then bringing them to the barest minimum. But of course, from the ambit of disaster management, we will be talking about how do we address the issues of hazard risk and vulnerability. Because in most cases, it is the convergence of hazard risk and vulnerability that usually degenerates to emergencies and disaster. So today, the topic that we are dealing with, of course, does really matter as far as Lagos State Emergency Management Agency is concerned. And of course, we'll be looking at some of the efforts and how far we have gone at ensuring that we provide an environment that is devoid of so much accident, that will identify and then address every hazard, risk, and vulnerable elements that are capable of creating an unsafe environment. Let us look at Lasema. Today we know some of the indicators that actually trigger emergencies and disaster in Lagos State. And I want to tell you without mincing word that this state, as much as it provides social and economic incentives that actually makes this state more of a space of opportunities, because of the fact that some basic indicators, such as population, economic incentives, which points at the fact that of course, this state is the center of excellence. We have 2 seaports, 2 areas with Ogun State, with Oyo State, and of course with Benin Republic. Actually triggers what we call rural-urban migration. And of course, the interaction between man-man and the man-environment components usually results to entropic reactions that increases the level of vulnerability, that also brings about emerging hazards. And then this interaction often results to so many conditions whereby we begin to see hazards and risks that become very random. And at the end of the day, we are having so many disasters in the state. Today in Lagos State, from the Command and Control Center, we receive between 80 to 100,000 distress calls on a daily basis, which amounts to about 2.5 to 3 million distress calls every month. And of course, you begin to wonder, do we deal with about 2-3 million calls every day? Yes, we do. Some of them being link incidents. Mr. X could actually pass through a particular point, and then he observes that there is an accident, and we have about 100 to 1,000 people reporting incidents, same incident at a particular time. And of course, dated back to 2002 when we had the Ikeja bomb blast, the state government actually felt that, look, it is important to put in place an agency of government that will coordinate emergency response, and of course will be responsible for managing the incident command system of the state, and of course that resulted to the creation of LASEMA under Law 16 of 2008 of Lagos State. And then the agency, of course, is saddled with the responsibility of coordinating all forms of emergencies and disaster, working hand in hand with what we call responders, such as LASAMBOS, the Rapid Response Squad, the Lagos State Traffic Management Authority, and a number of federal management agencies, and all other first responders, both in the state and then at the federal level. What are some of our responsibilities? Coordinating emergency response. Some of you will begin to look at the import of coordination. Today, Lagos State has been identified as one of the states that implements and then is very effective in the use of the incident command system. And you may ask me why. Because coordination is very important. Today, at the scene of any incident, you'll find out that there is a well-defined command and control structure where everybody understands his role and responsibility. And emergency response becomes very seamless. In less than 5 to 10 minutes, and at times 30 minutes, you find out that the incident management team are able to manage every incident. So we have what we call the LASEMA response plan, which of course provides for every agency. The Lagos State Traffic Management Authority are responsible for managing traffic. The LASAMBOS, of course, emergency medical services, LASEMA for search and rescue. So that's the essence of coordination. So the agency sits, and of course, the head of the agency sits as the incident commander, one who gives direction to emergency response in the state, manages the incident management team, provides a focus, and then draws what we call the incident objective from the incident action plan. These are all what we do to create a very safe environment. Then we are looking at the development of loss prevention program and procurement of necessary technology. Today, we all see what is happening. All you need to do is just to dial that 3-digit, that 3 magic number, 767112. It is relayed to the command and control center, and in no time, help comes. And of course, prompt and adequate response as well as sustained intervention. And I wouldn't want to dwell much on this. Hazard identification and risk assessment, which of course you see slide through the Third Mainland Bridge. We see a lot of our bikers. What they do is monitoring and surveillance, and this is also focused on reducing disaster risk. You see our bikers move, and they are able to see impediments. It could be 1 a.m. and you have a vehicle breakdown on Third Mainland Bridge. A biker comes there, does what we call the simple incident assessment, look at the safety and security elements that are there, looks at the location, is able to determine the kind of emergency, is also able to determine if that particular incident will result to what we call a secondary incident, and at the end of the day, we are able to address all lots of these. And I want to tell us specifically that for every 10 incidents you see, the Lagos State Emergency Management Agency has been able to prevent or mitigate about 100. Because those people you see around Third Mainland Bridge and strategic area are able to quickly assess an incident, specifically manage that scene, and they are able to call for help or perhaps prevent a secondary incident that will be result to additional loss of life and properties. Now we can see this. These are some of our interventions, and then that's the LASEMA response unit. That's the general manager there. This is the scene of a collapsed building in Lagos Island, and these are some of the things we do: coordination, working hand in hand with all other responders to ensure that we create a very safe Lagos. Now, it is very, very evident that if we look at the journey so far. When LASEMA started in 2007, 2008, and today, you would observe that drastically we have improved on our response time from about 2 to 3 hours to between 5 to 10 minutes and at times 30 minutes. And I think we deserve a round of applause. And how are we able to do that? The state government, through our very amiable governor, deemed it fit that one basic way to entrench safety and to reduce accidents to the barest minimum is to decentralize disaster management. And how do we decentralize? We'll create what we call basis or response units in strategic area cut across the 3 divisions of the state. Today I tell you we have a response unit at Kappa in Oshodi. We have a response unit along Ikorodu Road. We have a response unit in Lekki. We have a response unit today also emerging at Ijaniki, another one coming up in Ekpe, and one at Temu. What have we done? Basically, we are able to take disaster management to the grassroots, which is also in consonance with frameworks such as the Ayogo framework for action and the Sendai framework, which talks about institutionalizing and bringing disaster management to the local level. Because disasters are what? They are localized. If they happen at a particular locality. The closer this response units are to the people, the less will take more time in reaching out, and then we're able to do. This is the LASEMA response unit there. Then these are some of the equipment we procured. Now, beyond that, I want to talk about the area of coordination. Now, in terms of coordination, we were able to put in place what we call the Command and Control Center. And it may interest you. What is the interface between this particular place where we call the Command and Control? Now, once you put up a call through your 112-767 emergency toll-free line, it is relayed to what we call a call center, where you have call agents. These call agents are able to ask you what to call the frequently to look at specifics in respect of that incident, to determine the location, to determine the number of casualty, to determine the incident type, and they are able to determine the specific kind of responder to the disaster scene. Now what they do is that as they carry out search and rescue, they are also able to interface with the control room, where you have multi-agency coordination. And if you need additional resources, if it is a collapsed building, we are able to mobilize at this point. And this we have been doing, and it is able to create a state that is almost free from disaster, or if there is disaster, we are able to recover from that disaster effectively. My time is almost spent. Then I'll also look at the issue of sensitization and early warning. Sensitization and early warning are bent or geared towards reducing disaster risk. We have been able to embark on roadshow, have what we call our different stakeholders meeting, and the essence of this is for us to get specifics and to look at emerging issues as far as emergencies and disasters are concerned. And today, this has also helped us in what we call disaster planning. And I tell you, this is able to change. It's a game changer. Finally, I'll talk about simulation and dreams. Some of us saw what happened 2 months ago within the corridors of the Third Mainland Bridge, where we had a simulation codename Operation Okoja Sosa. And you find out that this has been able to increase our emergency response and preparedness, because whether you like it or not, along the Third Mainland Bridge and its corridor, we have witnessed up to 4 or 5 incidences where we have vehicles plunging into the Lagos Lagoon. And today I tell you, if we have similar incident along the Third Mainland Bridge corridor, we are able to respond between 5 to 10 minutes, and within 30 minutes to 45 minutes, our recovery operation would have been concluded. There isn't more time to talk, but I want to assure you that for us, safety has become a culture of the state. And all agencies are working together. The state today boasts to be one of the states in the federation that is able to apply the incident command system, that has a well-defined command and control structure. And we are improving, and we are not resting on our oasis. And I can assure you that someday, sometime, we will be able to eliminate, if not eliminate, bring our response time to about 2 to 3 minutes. Thank you, and God bless.
Distinguished guests, ladies and gentlemen, may I request that we once again appreciate the representative of the General Manager of LASEMA, the Director General, Lagos State Safety Commission, all other courtesies duly extended. Let me also introduce the Sector Commander of the Federal Road Safety Corps in Lagos, the Lagos State Sector, Mr. Hyginus Omeje. You are very much welcome. A round of applause for him. Let me also introduce the Director General, Lagos Chamber of Commerce and Industry, LCCI, Mr. Muda Yusuf. You are very much welcome. Lead consultant and CEO of Thrive Management Consultancy Limited, Lagos, Mrs. Olubunmi Fabanwu. She's making a presentation on the transformation agenda, workplace safety. A round of applause for her.
Good morning, ladies and gentlemen. Good morning, ladies and gentlemen. And to congratulate the list about 6 years ago or so to put a safety commission in place. And we must continue to salute a government that does these pace-setting things, transformation things. And we can also remember the DGs who pioneered the Safety Commission, and of course, our very able DG now, Mr. Dixon. Thank you very much for inviting us. It's a proud day for me to be here this morning and to present the transformation agenda and workplace safety. I will not pretend to be a safety expert. I am not, like there are some people. However, I will say that the transformation agenda, any transformation agenda is a leadership agenda. A leader that does not intend to transform his sphere cannot really and truly be a leader. Because one of the key things in leadership is transformation. Do you agree with me? Do you agree with me? In a directorate, wherever you are, even a leader without a title, we need to continue to do. What do we need to stop doing? And what do we need to start doing? Am I taking this organization to? Otherwise, really, you don't have any business being there as a leader. And so, I'm looking at the transformation agenda. Can we have someone to help us with that? Therefore, area. Can you put it together? Okay, is it together? Okay, sorry. It's a very highly regulated area, and indeed should be a priority for anybody in leadership position. If the people aren't there, the work doesn't get done. So you might as well ensure that they are there and they are safe. Therefore, it should be a priority of leadership. And who is a leader? He goes the way, and also he shows the way. And so when you look at the leader, he's showing you the way, he's going the way, he's walking his talk. And therefore this morning, as I said, we're looking at the transformational agenda. This is quite ambitious, don't you think? Lagos, vision, 0. 0 to what? 0 to injury, 0 to harm, 0 to 0 to 0 to 0. 0 tolerance. Indeed, it is a tall order. And you will also agree. Do you agree? There must be an intention to become 0. You can't just be a leader and say, well, they said there's going to be 0 tolerance, that's fine. How do we do it? How do we get there? Look at the 7 golden rules, which you must have looked at in the couple of days you'll be here. We'll look at why leadership is important in health and safety. We'll look at effective and ineffective safety management. the importance of health and safety, and we look at the role of leadership. Before we leave today, there will be of course, I just went back to have a look at the vision of Safety Commission, and I'm sure they're going to tweak this vision a bit very soon. And then the vision says to develop policies and strategies that will build a sustainable safety of the very best, and that's why we're supporting you in this very, very important conference. Safety Commission says, work safe, live safe. Work safe, live safe. A mindset change to achieving zero harm. We must live with the message. We want to achieve zero harm in the workplace. These are, just as a reminder, these are the 7 golden rules of Vision Zero. And I'm going to dwell a lot on leadership. Leadership needs to demonstrate commitment. We've got to identify the hazards. We've got to ensure a safe and healthy system. We have to ensure safety and health in machines, equipment, and workplace. Find targets. We've got to develop programs. We've got to improve our competence and skills in safety management. And certainly, we've got to invest in the people and to motivate them. These are the 7 golden rules I believe that was arrived at somewhere in Singapore. And we need to constantly remind ourselves of this and our roles in these rules. Of course, I'm sure the safety experts are familiar with all these signs, and they're looking very good. But we don't have enough signs still. We look at some construction sites. I was coming from Ibadan this time last week, and from the Ibadan stretch up to a particular point, a particular contractor was working, and there were hardly any signs. You are nodding, sir. Trace or guide. And as we went around that trace, there were no signs bring condition free from risk of injury or threat to health and well-being. Nicely copied from one of your safety things. However, of course, we realize all of this. Importance of health and safety in the workshop. Certainly, we know it keeps us safe. It keeps us safe. Injuries cost time and money. We have few injuries, and this will increase productivity. And of course, the public perceives us as being responsible, as being a good company, a good state, a good organization to work, a good place to be. And that's very important because public perception can affect your bottom line. It can affect your profitability. When they perceive that you're not a very good company, then you might be surprised that the word goes round, oh, and that could have a serious effect on the equity of your brand. Leadership, important. I dovetail quickly now. Why do we need to act? Why? We've got to change. Zero harm. Zero. Is it possible? Is it doable? And we say, yes, it is doable. Then how can we achieve it? To do a call to action. We've had the very wonderful presentations. Mine is a charge and a call to action. Talking is good, but we must act. And therefore, I'm charging us here as leaders in all directions, leaders of your departments, leaders of your directorates, and importantly, leaders of the boards, leaders of councils, leaders in public sector. We must say it. We must share it with our team. This organization is committed to safety issues. Our organization is committed. The commitment must start from the top, and you must be serious about it. And it must show, even from your immediate office, the MDCO's office, there must be evidence that you are safety conscious, you are health conscious. Communicate your commitment to safety and health programs. Let it be known. Let there be no, is she not, let it be known and say it. Secondly, define a program. Let there be goals, expectations, and then we develop the plan towards that vision that you've all agreed concerning work health safety. So first thing a leader must be, you must say it. that this is our organization. We believe in safety. We are going to be. In the banking industry, we want to be the best known for safety. In the construction, we want to be the best in safety. In the medical, we want to be the best. Say it and mean it. And share it with the topmost people in your team. This is what we want to do. Communicate it. And also, in doing that, then how do we do it? As appropriate. Quickly. And of course, these are things that people have said from time to time. And energy to ensure it stays at the core of the organization. Someone also said health and safety is integral to success. Board members who do not show leadership in this area are failing in their duty as directors and their moral duty, and they're damaging their organizations. And guess what? They could also be liable if there are serious issues. And thirdly, someone said, an organization will never be able to achieve the highest standards of health and safety management without the active involvement of its directors, of its top team. They must say it and they must mean it. So this is what, leaders who do it right, they pay attention. Those who don't do it right, they set no health priorities. And so just try to do it looks like when you do it properly and what it looks like when it is done badly. I'll just emphasize on number 3. What it looks like when done effectively. Ensure consultation with the workforce on health and safety. So much as it is a leadership matter, it is also, there must be These are some of the ways I would like to share in how we can implement a safety culture in the workplace. As we have said, top-level managers should prioritize it. They should take preventive safety measures, dispel the negativity towards safety. No, it can't happen. God forbid. We reject it. We can never have a fire here. Our enemies are upon us. No. Just go and do the right thing. Go and make sure that safety measures are in place. And of course, when we do it right, reward it, celebrate it. Let all of us know that of a truth, we put things in place and they worked. Promote positive vibes about safety efforts will shift the overall mindset around safety. And include safety education in your safety training. Some spend a whole lot of money on training, but you'll be amazed that nothing is said about safety in the workplace. Amazing. And as we begin to wind down again, what could happen? As you can see, if you fail to manage your workplace safety, you got a near miss, injury, and of course, again, God for once lost, very difficult to bring. So everybody knows that you are responsible primarily for your health and safety. And you must have an open conversation around health and safety. I'm afraid, okay. Therefore, as a leader, your commitment to health and safety will certainly have a positive effect on the organization. And it isn't do what I say, but do as I do. Very important. When you make it clear in your words and your actions that the only acceptable option is to work safely, you are a strong culture that will protect your people and your business. And on that note, I say thank you very much as you go ahead to be a transformational leader in work and safety. Thank you.
Let us once again put our hands together for Mrs. Fabanwo for that wonderful presentation. Distinguished guests, ladies and gentlemen, let me also inform us that the Lagos Vision Zero Conference 2018 is on the social media platforms. We are on Twitter, Facebook, Instagram, and YouTube. This event is also being streamed live on www.thesafetyradio.com. So you can log into. I'll invite now to make his presentation the Director General of the Lagos Chamber of Commerce and Industry, Mr. Muda Yusuf, is going to make a presentation on the employer perspective on zero harm in workplaces. Let's put our hands together to appreciate him.
Good morning, distinguished ladies and gentlemen. I'm to present the employers. First, let me express the invitation extended to me to be part of this very important conference. Secondly, I'd like to commend happening with LASEMA in the safety area. We are impressed with it, but they need to be empowered in a very sustainable way so that they can deliver on their mandate. Then this is just an aside as I round up. It's about safety on our roads. This is not about workplace. I'm happy VIO is here, Federal Road Safety Commission is here. Increasingly, I'm seeing very rickety vehicles on our roads. No regulation at all. Anybody just puts anything on the road and begin to carry passengers. And you know the implication of that. Some of them carry as many as 20 passengers, 30 passengers, bad tires, no mirrors, nothing. I agree there was sometimes some excesses on the officials of VIO.
I appreciate Mr. Muda Yusuf for